Good day everyone. My name is Anori Victor. I am a neurology applicant and I will be doing the Ching's comprehensive review in clinical neurology. We've done questions 1 to 57 and right now we'll be doing 58 to 16. So let's begin with 58. We have a 67-year-old man who presents with symptoms suspicious for cavernous sinus thrombosis. Which of the following nerves is not located in the cavernous sinus? So, first of all, we need to know the nerves that are in the cavernous sinus. They include cranial nerve number 3, number 4, number 6, and number 5, in particular V1 and V2. So, number 3 is the oculomotor nerve, number 4 is the trochlear nerve, number 6 is the abducens nerve, number 5 is the trigeminal nerve, and V1 in particular, which is the ophthalmic division of the trigeminal nerve, and V2, which is the maxillary division of the trigeminal nerve. So, the mandibular division is not a part of the cavernous sinus. That's option E. So, we have question 59. Regarding the trigeminal nerve, which of the following is correct? Okay, good. Which of the following is correct? The maxillary division supplies the skin of the lower lip. That's false. The maxillary division supplies the lip of the upper lip. B. The ophthalmic division innervates the entire cornea. That's false. The ophthalmic division innervates the upper half of the cornea. C. The mandibular division provides sensory innervation to the upper teeth. That's false. The mandibular division actually provides innervation to the lower to the lower teeth, not the upper teeth. The upper teeth is by the maxillary division. D. The mandibular division provides tactile sensation to the anterior to third of the tongue. That is true. And E. The trigeminal nerve provides the afferent and efferent limbs of the corneal reflex. That's false. The trigeminal nerve provides the afferent of the corneal reflex, while the efferent is by the facial nerve. So, question 16. Regarding the cause of the trigeminal nerve from the cranium, which of the following is incorrect? A. The maxillary division exists through the foramen rotundum. So, how I remember this, I said I use V1, V2, V3. So, SRO. So, the V1, which is the ophthalmic division, comes from the superior orbital fissure. The V2, which is the maxillary division, comes from the foramen rotundum, and the V3, which is the um, mandibular division, is from the foramen ovale. So the maxillary division exists through the foramen rotundum. That is true. The ophthalmic division exists through the superior orbital fissure. That is true. The ophthalmic and maxillary division are the only trigeminal division that travels through the cavernous sinus. That is true. The three divisions of the trigeminal nerve arise from this palatine ganglion. That is false. The three of them arise from the trigeminal ganglion, not this palatine ganglion. But then the trigeminal nerves actually make up the part of this palatine ganglion, but they are not from the ganglion. We're going to talk more about that. And E, the mandibular division exists through the foramen ovale, which is true. So options D is incorrect. So let's do a quick explanation. Now, the trigeminal nerve actually carries sensory information, and this information comes from the face, and it supplies the sensory and motor innervations to the muscles of mastication. Now, it actually emerges from the pons in the mid-lateral surface, and the trigeminal ganglion, which is also known as the Gardnerian ganglion or the semilunar ganglion, is actually a sensory ganglion that is located in the floor of the middle cranial fossa with a depression which we call the Meckel's or the trigeminal cave. Now, there are three primary divisions that emerge from the trigeminal ganglion, aka the Gardnerian ganglion, and they include the V1, which is the ophthalmic division, the V2, which is the maxillary division, and the V3, which is the mandibular division. Now, the ophthalmic division actually leaves the trigeminal ganglion, that is the Gardnerian ganglion, and exits the cranium through the cavernous sinus and the superior orbital fissure, and it goes on into the orbit. Now, it branches into the tentorial, the frontal, the lacrimal, and the nasociliary nerves. Now, this V1 actually mediates the afferent limb of the corneal reflex, while the efferent, like we said before, is provided by the facial nerve. Now, V1 division actually supplies sensation of skin to the nose, the upper eyelid, the forehead, and the scalp as far back as the lambdoidal suture. Now, it also supplies the upper half of the cornea, the conjunctiva, and the iris. It supplies the mucous membrane of the frontal, sphenoidal, and the ethmoidal sinuses. It also supplies the upper nasal cavity and septum, the lacrimal canal, and dura mater of the anterior cranial fossa, the falx cerebri, and the tentorium cerebri. Now we have the maxillary division, which is V2, and this leaves the gasserian ganglion and travels through the cavernous sinus and exits the cranium through the foramen rotundum. It enters the sphenopalatine fossa and then enters the orbit through the inferior orbital feature. Now, branches actually include the zygomatic, the infraorbital, the superior alveoli, and the palatine nerves. The V2 division supplies sensation to the lower eyelid, lateral nose, upper lip and cheek, lower half of the cornea, conjunctiva, and iris. It also supplies the mucous membranes of the maxillary sinus, the lower nasal cavity, hard and soft palate and upper gum, the teeth of the upper jaw, and the dura mater of the middle cranial fossa. Now, the mandibular division, which is V3, actually leaves the gasserian ganglion and exits the cranium through the foramen ovale, travels in the infratemporal fossa, and branches into the buccal, the lingual, the inferior alveoli, and the auriculotemporal nerves. Now, the V3 division does not travel to the cavernous sinus, and therefore it is spared in cavernous sinus thrombosis. Now, apart from the muscles of mastication, V3 also supplies the skin to the lower lip, the jaw, the lower jaw, the chin, the tympanic membrane, auditory meatus, the upper ear, mucous membrane of the floor of the mouth, the lower gum, the anterior to third of the tongue, northeast, which is facial, and the teeth of the lower jaw, and dura mater of the posterior cranial fossa. Although most of the posterior cranial fossa innervation arises from the upper cervical nerves. Now, our cavernous sinus itself actually contains the ICA, that's the internal carotid artery, the postganglionic sympathetic fibers, and cranial nerve number 6 on the medial wall adjacent to the sphenoid sinus. Whereas cranial nerve number 3, 4, V1, and V2 are actually found along the lateral wall. Now, the cavernous sinus receives blood from the middle cerebral veins and drains into the jugular vein via the inferior petrosal sinus and into the transverse sinus via the superior petrosal sinus. The two cavernous sinuses are connected by intercavernous sinus that lie anterior and posterior to the hypophysis, forming a venous circle around it. It's important to note that the sphenopalatine ganglion, which is the pterygopalatine ganglion, is a parasympathetic ganglion that is found in the pterygopalatine fossa. It's the largest of the four parasympathetic ganglia of the head and neck, alongside with the submandibular ganglion, the optic ganglion, and the ciliary ganglion. Now, the sphenopalatine ganglion is associated with the branches of the trigeminal nerve and the facial nerve, and it supplies the lacrimal gland, the paranasal sinus, the glands of the mucosa of the nasal cavity and pharynx, the gingiva, and the mucous membrane and glands of the hard palate.